A documented treatment plan is one of several key quality metrics in the oncology care model and other alternative payment models. Although required by the oncology care model, there are many benefits to implementing a documented treatment plan. From increasing communication between clinical staff to helping engage patients in their care, a documented treatment plan offers many advantages.
The treatment plan that we have developed consists of 8 of those required elements, with the other elements being done by other members of our staff. The treatment plan is really something that the physician and the patient do together as an informed decision-making process so that the patient knows exactly what is happening to them with their treatment.
Each section is important in helping the patient understand what to expect in the coming months of treatment. The treatment plan also plays an important role in shared decision-making, a key aspect of new value-based payment models.
Shared decision-making is part of the oncology care model, demonstrating that we perform shared decision-making. And shared decision-making is really not just that we have a conversation at the patient, but that they participate with us in the conversation. And not just that they participate, but that their values and preferences for treatment get incorporated into their treatment plan.
The treatment plan is important because it is one of the foundations of what's called patient-centered care. The idea is really for patients to play a much more engaged role in deciding what treatments they get and what treatments they don't get. And that's based on their values and their goals. And so the treatment plan is an important part of that.
According to a survey conducted by the Institute of Medicine, patients want to be listened to know the full truth about their diagnosis, risks associated with treatment options, and an explanation of how each treatment option could affect their quality of life. A documented treatment plan helps facilitate these discussions with patients in a format that they can take home, study, and share with family.
There are a lot of benefits to the treatment plan and what it can bring to patient care. First and foremost, it really allows patients to have in writing what we expect their cancer journey to be. Many patients have difficulty remembering everything that they talk about during that initial visit, and most take notes and things, but what we find is that by having this as a written document, patients are able to come back to that over and over again and really more fully understand what's going on with them. Additionally, when they share this information with families, it's there in writing that the physician has done with the patient, and so everyone's on the same page. We've also found improvement in our clinic workflows, so the nurses and the other staff know exactly what the patient has been told about their care, and so the communication can be consistent with that patient across their journey.
Patients seem to like kind of being able to go back and revisit that conversation because in many cases what we heard without a care plan is patients are not kind of digesting that information, or at least parts of that information. So patients seem to like that, and the teach back that they do at their chemo teaching session and with their navigator visits has become much more useful to them rather than seeming like new information each time.
Implementing a documented treatment plan takes some adjustment. If it isn't part of your normal workflow, you will need to find a treatment plan format and process that works for you. From experience, physicians have found that once you implement documented treatment plans, they become a valuable part of the patient care team relationship.
I can't emphasize enough, I think the most important part of the treatment plan from the physician perspective is to give it a go. And the first time you do it, it's not going to go well. So, try it out on a patient and try it out on someone who you think might be easier to do it on, and practice it. Nothing is easy the first time you do it. But if you practice it once, twice, and then by the third time, usually you're comfortable enough that you can give fair criticism to it. Don't be resistant to try.
One perceived reason for resistance is patients may not like it. All the feedback that we've gotten so far is that it's a very positive experience. Patients appreciate the detail, and oftentimes patients are nervous and have trouble retaining what they're told, and to have this document to use more than once, and they can share it with family, they can refer to it, they can bring it back to the physician and ask for a refresher. The patient's perspective on the treatment plan has been positive, and I think that should not be a reason for not doing it.
This is not something that you necessarily do on the very first encounter with the patient. Often you've had some chance to develop a relationship with them.
And in our experience, patients have been very engaged in having this treatment plan filled out with them. And to really think about that when you're doing this, that the patients really want this information and desire this information from you. The other thing that I think is really important that physicians get hung up on is that you don't have to be perfect. Everybody knows that we can't predict the future. Can't tell you exactly what your prognosis is. I can't tell you how long you're going to live, but I can give you a pretty good estimate of that. But they really want to know that information. But it doesn't have to be perfect. And everybody knows that you're not perfect, but that you have the best experience and knowledge to give them that information as best as you can.
Whether you're just starting to implement a documented treatment plan or need to refine your current process, we're here to help.